to that end, I would love to introduce our first speaker for today, Jill Farris. We actually started our career the same year in 2007, her in Minnesota and me in Indiana. So our lives have intersected in lots of different ways because people stay in this work because it's awesome. So, good testament to that. So I will tell you a little bit about Jill. She's the Director of Training and Education at the Center for Healthy Youth Development at the University of Minnesota. In this role, she leads capacity building initiatives to strengthen community-based adolescent sexual health programs. So all those words, but she is an excellent, outstanding trainer for people who are working with young people, expert. She has all the skills to facilitate sexual health programs. She's certified trainer on so many evidence-based interventions. Think of an evidence-based adolescent sexual health you've heard of. She probably trains it. She knows adolescent health. She knows all of the cultural and social factors affecting adolescent health. She leads the creation and dissemination of the annual adolescent sexual health report. Is that Minnesota specific? Yeah, so for the state of Minnesota, does a bunch of work on county health reports, data visualization. So we were just talking about how we have all this data and we want to make sure we translate it so that providers can use all of the data that we know around sexual health and people and use it in a way that's practical. So she's really great at that. She's committed to health disparities and really just pleased to have you talk to her about adolescence. So Jill, welcome. Thank you all.
Oh, good. I'm glad to see there's a step over here. I was like trying to figure out how I was going to navigate jumping up onto the stage. Not that tall. Hi, friends. All right. There's nowhere to put my coffee, so I'm going to put it behind me. That might be dangerous, but we're going to see what's going to happen. All right. So I guess somebody will be advancing my slides for me. I didn't actually. Oh, I have a clicker. Delightful. I'll be advancing my slides for me. That's how that's going to happen. All right. Hi, everybody. Welcome. I am so delighted to be with you. I am your neighbor to the west. I come from Minnesota, but I feel like Minnesota and Wisconsin are so linked in so many ways. I was actually telling the HCT folks I was just in Milwaukee last weekend for a gymnastics meet for my kids. So I was just here in your fair state spending lots of money on all kinds of good stuff in Milwaukee last weekend. So very delighted to be back with you in Appleton. I've also never been to Appleton and also finding it to be a really lovely place. I love Wisconsin. Y'all are great. So I am delighted to get to talk to you today about one of the most fun things to talk about, which is talking about sexual health with young people. Hooray. That might not be your favorite thing to talk about, and that's okay. We're going to get everybody to a place, hopefully today, where they are feeling more confidence and more comfort with all of the things. So I'm going to move us forward in terms of our agenda and kind of what we're going to cover today. I'm going to move my phone off of my right. All right. So I want to tell you a little bit about the center that I work at and kind of where I come from. So for about 25 years, the center that I worked at was actually funded by the CDC, and we were a CDC-funded center that was a prevention research center. These centers are all over the country. There's 26 of them, and for many, many years, we had this funding as a prevention research center to do community-based participatory research. And in this last round of funding from the CDC, the priorities that were listed there just really did not jive with most of the folks that do research in my division. So we decided to sort of punt that funding over to our School of Public Health. So they have that funding now, but it is a little bit confusing sometimes because the name of the organization that I work at and have worked at for a long time changed last year. So we're the Center for Healthy Youth Development. We still do all the great and awesome stuff that we've always done. I get to do the really fun work, I think, of taking the work of academia out into the field and working with people like you to make it usable and practical for our work with young people. So here are all the ways that you can get connected with our center, and a lot of the resources that I'm going to show you later are on some of these QR codes. So you've got it all here for you, and you're welcome to look at that website for any types of resources that you might need. Okay. Oh, I see. I right as someone was taking the picture of it. It's all right. It's all good. It's not rocket science. It's CHYD@umn.edu. You can type that in faster than you can probably get a QR code. Okay. So let me tell you, who am I anyway? Why do I get to stand in front of you today and tell you about this topic? Well, Abby read to you a whole bunch of really nice things about my bio and my background and my academic background. And those things are great. And those things all really matter in terms of why I have the expertise I do and why I stand in front of you today. But I also am here to talk to you about communicating with young people. And so I wanted to tell you a little bit about how I communicate with young people, just in my personal life and in how my personal and professional lives intersect in a lot of ways. Because what I do and what I care about, as Abby said, when we get into this field, so many of us find that we're called to it and we stay in it for decades because it calls to us. And so our work shifts and our work evolves. And I think about my work in terms of like how I work with young people and support young people. It all kind of bleeds together. So I'm a parent. I'm a mom of a 15-year-old and an 11-year-old. So that picture, let me see if I can get a, there's my there's my little laser pointer. The picture in the bottom corner, the bottom in the middle is us finishing a triathlon in Minneapolis last year. Yeah, I know. So my daughter was 14 when that picture was taken. So she ran and she did the full race with me. I've done it for a long time, and people compliment me on it. I'm like, yeah, but I've done it a lot. Like that is the developmental sort of like where she is developmentally, the bravery that I think it takes to be able to do something like that when you're 14. I just think it's really amazing. So I just wanted to highlight my own kid, shout out my own kid. And I do have permission, by the way, to show you this image. Although she's like, Mom, that picture is so bad. I look so tired. Like, yeah, girl, because you just did a triathlon. And I also I'm a Girl Scout troop leader. So that picture on the top is my troop last year delivering Girl Scout cookies, donated cookies to our food shelf in our neighborhood, where we gave cookies that people had donated. And my Girl Scout troop experience is very, very tied in with the work that I do, communication and work with like sexual and reproductive health. My Girl Scouts are like, really? You're going to talk to us again about puberty and again about communication? And oh, you're going to ask us again if we know how to like access, resources in our community? They love me. But I bring in the work that I do into the work that I do with my Girl Scouts. The thing on the bottom right-hand side is the Our Whole Lives logo. I didn't want to put a picture of young people in the scenario because it felt weird to do that. But Our Whole Lives is a curriculum that is taught in, it's kind of a curriculum that's collaboration from the Unitarian Church and the United Church of Christ. And it's a curriculum that gets taught in some religious contexts so across the country. And I teach it in a Unitarian church in Minneapolis in 8th grade. The kids in our religious setting get this religious education program for the whole year. So in 8th grade, they get a whole year of sex ed. They also get it in 1st grade and 6th grade and 10th grade too. So I teach it. So I teach sex ed in this different context of religious education and understanding religion from a spiritual perspective. And then on the left-hand side over there, okay, you guys, last night I was looking at these slides and I was like, dude, I wore that exact outfit yesterday. How embarrassing is that? I promise I have other clothes. Oh my gosh, that's not the first time this has happened to me also, where I'm up here presenting and showing a picture of something and I'm like, oh yeah, well, I apparently like to wear the same things. I am the board chair of Honest Sex Ed Minnesota, which is a nonprofit that was pretty recently started in Minnesota to address the gap that we have around policy and advocacy. We really don't have an organization that's working to advocate for young people at the Capitol and on their behalf. And so that is a picture of me providing testimony at the Capitol last year to prevent the repeal of the statewide health education standards that the legislature had passed the previous year. So in the 2023 legislative session, they passed statewide health education standards, and then last year there was an effort to repeal it. So I spoke in support of not repealing it, and then there's a young person below me that's in the picture below me that I helped prepare some testimony for. So again, thinking about all of this stuff from a developmental lens and a developmental perspective, this is me, this is what I bring to the table, this is who I am. All right, so what are we going to do today? We are going to talk about really what makes adolescent healthcare and what makes high quality adolescent healthcare. What are those features? What are those tenets? What are those components? I know you know a lot of these things, and a lot of these things are going to be things that you're going to realize that you're already doing, excuse me, in so many other kind of ways, and in a lot of the ways that you do your work. It's probably just going to be a way to highlight and illuminate that you're already doing a lot of things well. I'm going to talk to you a little bit about a framework that we developed at the university, really just a simple framework to help clinicians and practitioners just to help. And I'm going to explain kind of how we got there, but I'm going to also just give all these tools to you because all the stuff we developed, we want everybody to use it. So we're going to talk about kind of this framework that we use called Support and Guide, which is just a really simple paradigm for how we talk to young people in clinical conversations, and talk about kind of these fact sheets and different things we've developed and how you might use them or not use them. And then part of what we, in developing these fact sheets and these support and guide frameworks, part of what we did was we think about motivational interviewing and all of these basic principles of this and how it can be used in clinical settings. There was so much yesterday from what Dr. Berg-Ronick shared that was actually really so highly tied to when you do things from a trauma-informed approach, or many times doing things with the spirit of motivational interviewing. So there's a lot of, I think, callbacks and tie-ins to what we heard yesterday, and I hope that we'll be able to make those tie-ins as we go forward. All right, one more irreverent slide for you. Because I'm from Minnesota, I had to, okay? So yes, I know. There's so many good expressions on this slide. And I know, so I full disclosure, stole this off the internet, which is why I couldn't change the title at the top. So what I want you to actually tell me is not how you're feeling today, although you could, I mean, maybe this is the same answer for you, but how does talking to teenagers make you feel? When you think about like, okay, I've got an appointment with a young person and that's next up for me. What's the feeling that comes over you? And I'll let you settle with that a minute. And then I think I may need some assistance flipping to our Mentimeter page to actually see the results. Actually, you know what? We probably didn't load that, did we? No, we didn't. That's okay. I have a plan. We can know the results. I'll just tell you what they are. Because I can run the poll on my computer up here. Just let me log in. All right. So did everybody, and if you didn't get the QR code, or if you're online and you're like, well, this is rather silly. It is rather silly. It's totally fine. And if you want to enter a number into the chat, that's totally fine too. Really, the goal here is not for us to see, oh, wow, everybody today is a 4. The goal really here is for me and for all of you to kind of get the sense of like, where am I today? How does this make me feel? And my challenge for all of you would be to move yourself, maybe, if you're finding yourself today in a place that's more discomfort or more of just like, this doesn't feel as comfortable to me as I would want it to feel. This doesn't feel like sort of my place where I'm getting a lot of traction. I want to move you to that today. That's our goal. So I actually don't even think I need to pull up the poll, I think. But what I do want to know is sort of what folks, let's just do like a little shout out in the room. What's the prevailing feeling? How are people feeling? Shout out for me what your number was. 4, 6. 6 is like, heck yeah, I know what I'm doing and I'm going to teach you some things today. 4 is like, wow, we got a lot of things to unpack here. Any other numbers resonating with folks? 9. 9 is like, listen, there's some things that we need to go over today. Like what's going on? Yes, my friend. Curious what 2 is supposed to be. It's the power of you deciding for yourself what 2 is supposed to be. I mean, yeah. So yes, thank you all for doing that, indulging with me. I know that was a little bit silly. And I also do think that there is some utility in thinking about like, how does this make us feel? How does working with young people make us feel? Because for some of us, we're like, yeah, I love working with young people. It's my jam. It's my element. I feel good. You're the person in the office that everybody's like, send the teenagers to them. And that's a skill set. That's amazing. That is a power. And it's okay if you're not that person. If you're like, it's just not my strength. It's something I know I need to get better at. That's what we're all here to do. As Abby said, building the workforce and training all of you to do better every single day is how we make little baby steps towards all the changes that we know young people need. Okay. So I'm going to really briefly talk about adolescent development, again, just to ground us all in the same place. I know this is super, super review for some of you, but it's a really exciting time for young people, right? Adolescence, there's tons of things going on. It can be exciting, which excitement can translate into stress. It can translate into challenge. Teens are usually physically experiencing, growth spurts, puberty, and maturing either later or earlier than your peers can cause a lot of stress. It can be a source of bullying for some young people. Rapid physical development makes nutrition and sleep and physical activity really important. And we know young people should be getting a balanced diet and they should be getting 60 minutes of physical activity every day and 9 hours of sleep, even though their internal clocks are shifting and make them want to stay up later and not get anywhere near 9 hours of sleep. In terms of cognitive development, cognitively, adolescence is a really interesting time of like increasing responsibility, increasing desire for autonomy, thinking more about like having more just ability for abstract thought and complex thought. By the end of adolescence, we really want young people to be able to function mostly independently, but they usually need some support to get there because usually the brain, the frontal lobe, is still developing until mid 20s, even late 20s. We're seeing new research all the time about this. And then psychosocial development, it really is about this process of figuring out identity development. This is the process of youth trying on lots of identities, maybe being rebellious. This can be, we can sometimes see this happen or sort of manifest itself with like self-esteem. Some young people may have really high self-esteem in some areas, really low self-esteem in others. And so these are only some of the changes, right, that our young people are experiencing. These are, I'm just painting a really big, broad picture. There's also just a lot of things that are going on for young people that are complex and that are sensitive. And so we know that that means for us that we need to shift. We need to shift our tactics and we need to have effective communication with adolescent patients and their parents and caregivers. That's one aspect of high quality adolescent healthcare. So communication is what we're here to talk about, and we're going to talk about it, but it's one aspect of this diagram circle that you're looking at here in terms of the key features of quality adolescent care. So there are a couple of things to kind of just note here what you're looking at. So what you're seeing here is really all of these different features and factors that are going into quality adolescent care, and really in the center, in it sort of wrapping around it all, or sort of in the center of all of it, is cultural sensitivity and responsiveness. So cultural sensitivity and responsiveness is like, asking questions and learning about values and priorities, of course, making sure we have interpreters and language materials that are relevant, communicating information, easy access, having access to, hours that are after school, that are flexible, having policies if young people are late for their appointment that are like different than we have for an adult patient, that we have a variety of support, that we give young people a variety of sort of ways to access us, and that we have consistency, that we're the more consistent and dependable, the better. There's a lot of things on here that overlap with a lot of the things that we saw yesterday that are kind of the key features of something that's trauma informed. So again, there's a lot of things here that I hate the phrase killing two birds with one stone, but somebody let me know if you have a better phrase. But that's what I mean, is sort of like you're getting more bang for your buck. Let me say that, more bang for your buck. So when we think about key features of adolescent healthcare, it's really, I think, important confidentiality is obviously paramount, right? So confidentiality is the absolute paramount thing that we need to make sure that we are maintaining. And we also want to leverage this triad of, our patients, our parents and caregivers, and us as the providers. At every opportunity, we really want to make sure that we're giving young people choice, praising them for the ways that they are taking responsibility. When they're setting small and achievable next steps, those are the exact kind of things that we want to highlight and we want to praise them for. There's a saying that sometimes people use in like parenting work or work, especially with like ECFE and young parents, which is like shine the light on the things you want to grow. And I love that statement just as a way to think about a strengths-based approach to all the things that we want to do with young people. We want to shine a light on the things that make them unique, the things that make them special, and the things that are the things that really are things that they enjoy and things that are things we can build on. So shared decision making is really about fostering and acknowledging autonomy. And so in some adolescent care, really in particular, it's so important, of course, to have clinical communication skills, but also like these counseling skills play such a significant role in providing high quality adolescent care. Okay, so I'm going to share with you results from a study that we did with, you can see who it was with. It was with adolescents, parents, and primary care providers. I'm going to walk you through everything up here because I realize it's really tiny writing for some of you, depending on where you're sitting in the room and everything. So we surveyed, as you can see, 1,000 pairs of parents and young people, so youth between 11 and 17 years old and their parents. And then we also did a lot of in-depth interviews and kind of focus groups with clinicians, and then parent and youth dyads. And so there was a lot of things that we found, and the things that we found really helped us move forward in terms of like the products that we created and the things that we wanted to do for the field and for our providers. So one of the things that these interviews told us was that parents and teens want to talk with their primary care providers about this stuff, and they are really open to it. A lot of times parents and teens told us that they just didn't have the chance, that they wanted to have this conversation, but like the opportunity wasn't given. Clinicians told us that they also told us that they were open to this. Clinicians were like, yep, we are open to these conversations, but we want resources that are related to this to help us do this, because a lot of the folks that we talked to, some of them were seeing a lot of young people in their practice. Some of them were seeing 1 or 2 or 3 young people a month. And they're like, okay, I want to do a good job when I do see this young person that comes into my practice, but like this is so few and far between for me. I need some resources. I need something I can just really quickly pull. I need a real quick paradigm that I can borrow to like guide a young person through what I should do. And so you'll start to see as I show you the resources and the tools that we've created. These were really all created exactly with providers in mind. They were all created because providers told us it was a need. And then parents also told us that they were comfortable with one-on-one time. I think time alone with a provider is something that sometimes some of us may think may engender resistance. That may be true in some instances, in some cases, but there are, for the most part, parents are typically comfortable with one-on-one time between youth and the care provider. I'll share a little bit more about that. So the vast majority of parents were comfortable with time alone if it was framed as part of helping teens take more responsibility in their healthcare, which I think is really a helpful way to think about framing what we talk about. And parents also were fine with, again, time alone. They want to know, though, that it's a standard practice and not something that's a specific concern or worry about their own kid, which just makes a lot of sense. And young people told us, please, please, please help us, give us an opt out, not an opt in, right? Like, I don't want to have to tell my mom that she has to leave. So these are some quotes from young people in our survey. So this first young person said, the doctor gave me a choice and I said, oh, I don't care. So my mom was like, okay, then I'll stay. So I was like, oh, okay. And I was embarrassed. And the second young person said, I mean, I don't want to tell my mom to leave. It always makes me uncomfortable. Yeah. So these are not unreasonable requests from our young person, right? In these 2 examples. And so teens really want us to set those guidelines and set those boundaries to say, all right, let's set the parameters for an opt-in, or sorry, an opt-out, not an opt-in. All right. So we also have a lot of different things that when we did these interviews with providers, there were really some key themes that emerged in terms of the factors that influenced what made a provider decide to initiate time alone. And what I wanted to do is actually read for you a quote from each of these 6 different buckets that kind of explains a little bit about why the provider just kind of felt the way that they did about how to introduce time alone. So in the adolescent characteristics one, so this is one that was sort of identified as like, there's sometimes something about a young person that makes me say, this is a reason that I might spend some time alone with them. So this provider says, if I know that a kid is already sexually active, or if I know that they have a history of substance use, or if I know that their family situation is challenging in a certain way, or if they have depression, I will typically start with the things that I know and probe around that, just because I anticipate that being the bigger issue. Otherwise, if I don't know anything going into it, I will tell the kid usually, just like I have a list of questions that I ask everybody, but do you have things you want to talk about first, or without your parent in the room, or ask about first without your parent in the room? Right. So this is just a provider saying like, okay, I already know some things about this young person. I maybe know their family situation. I have some sense of like what they're coming in with. It's similarly, a similar vein, the reason for the visit. So this quote from this provider says, for kids coming in with concerns about acne, sometimes they specifically request birth control, or they ask about it, and I'll have parents step out for that. And usually it's, okay, I actually need birth control, not for my acne, or maybe in addition to my acne. So that's an example. For kids that come in with colds or other things, I don't usually have the parents step out for that. I'm reading you direct quotes. They don't always make a ton of sense. Okay. They're a little convoluted in terms of just the thinking here, but these are literally just direct quotes from our providers. Okay. Adolescent parent interaction. So here's a quote from a provider. I have a handful of patients where parents know their kids are sexually active. They already are aware of this, or they know that their young person is having suicidal thoughts. And for those, it's helpful to have. It works better when parents and the teens talk to each other. And for that, I will sometimes make an exception for that. But I always do offer, and I'd say, except for those rare occasions where teens and parents are really 100% transparent, then I always do them separate. Okay. Parent understanding and support of private time. So here's a quote from a provider. Well, I think we've been doing it long enough that parents expect it. And they say, when are you going to let me go? Sort of sometimes for the parents. In the beginning, it was a challenge. You'd have all the conversation, blah, blah, blah. Really says blah, blah, blah in my notes. That's funny. And now, really rarely do I need that anymore. Just the grandma last week is the only one that I've had for a long time. I was shocked and I thought, okay, now I have to think about what I have to say now because I haven't really had to do that for quite a long time. Some of them will ask me why, and I'll tell them why. And if they don't want me to do it, then I don't. Okay. Next one is around laws and professional guidelines. So this quote from a provider just says, I just have to say that's confidential and I can't tell you legally. I can't talk to you about that. So usually they're fine with it. They don't press the issue. I say, you can always talk to your child about that, but I can't talk to you about that. Okay. And the impact of culture is the last one. So this quote from a provider says, I say the things that we talk about in this room are confidential, but I have heard that there's fear that the interpreters here are going to share information because they live in the same community or possibly in the same building. And even I've had the concern before because I've had some looser lipped interpreter experiences where I'll say it to the interpreter and the patient kind of both. I mean, I'm saying it to the patient, but I'm really intending to communicate it to the interpreter that this is a legally protected confidentiality space. And so I find that to be really useful. I don't know if it actually works, but I find that I think it does. Right? So you can see here that there are lots of really good reasons, and there's a lot of intersecting and overlapping ness to these reasons. In terms of sort of how providers decide to initiate time alone, I think that last one in particular around sort of cultural considerations is one that is something that maybe is something new for folks or something to think about in a way for some of our young people in particular that when we think about interpreters and the kind of information that's being shared, that there's an additional layer here to think about for our youth in terms of confidentiality. Okay, so from here, we developed a toolkit that I'm going to share with you and share some strategies and tools and all kinds of things with you. So what we really wanted to do was we created some tools, and the goal of creating these tools was three things. One was to increase the rate of confidential time with an adolescent and their provider. The second was to facilitate conversation about behavioral health topics. And the third was to improve conversation between all these different groupings, between teens and parents, between teens and providers, and between providers and parents. So we created this program, and it has three components, and they are as follows, and we're going to talk about all of them. We're going to talk about the support and guide communications framework. Again, this is really a really simple and like sort of bare bones way of like, it really is just like motivational interviewing distilled down into something very, very usable and easy to use. We also created a bunch of tools. Providers were like, hi, I need like something to look at to like kind of guide me through this conversation. It doesn't need to be long, and it should actually be pretty and engaging and all of these things. So we created some tools to help with that. And then we also helped some clinics that we worked with in terms of we created these tools, we gave them these tools. We helped them standardize some adolescent friendly clinic practices. Excuse me. So two of these practices were, of course, standardizing time alone between an adolescent and their clinician. But the other one was sending a welcome to adolescent care letter to young people and their parents before preventative visits to help them know what to expect, as well as things that they can do to prepare. And I know that in different systems have different, sort of age floors for when this begins in terms of like when a letter like that might go home or when that time alone with a provider might start. But if you don't have a process like that in place at your clinic, sending some kind of note home around the age of 11 or 12 is usually what's recommended in terms of standardizing those adolescent friendly practices. I'm going to get a drink. Hold on one second. Okay. So we developed this toolkit, and this paradigm of like support and guide really is just an easy way and an alternative to use instead of motivational interviewing. I am going to talk to you about motivational interviewing. Motivational interviewing is great. I'm a person who uses it all the time. It's also really complicated, really complex, and kind of just like a big behemoth to get your hands around in some ways. And so our goal with this was really to distill it all down into something that was really super easy to use and usable. So we really, the idea behind creating this support and guide framework and paradigm was the idea that when people feel confronted and taught, they're less likely to change their behaviors. This is not anything that is new information to anybody in this room, but it is also the kind of thing that we sometimes inadvertently do when we are in spaces and places with young people, whether we mean to or not. And so we want to, of course, avoid things like direct persuasion. We want to avoid argumentation, and we want to avoid being prescriptive. It's easier said than done. A lot of us were trained in ways where sometimes the words that come out of our mouth are absolutely, persuasive, or we might be trying to sort of argue in a certain way, or be prescriptive because we have the answer and we know and we have the information and we want to share it. Providers usually don't have time for MI, but this abridged version is something that has worked pretty well for folks that we've shown it to. So the idea here is really simple: support and guide. Everyone can remember support and guide. So in terms of support, we always want to find something, anything to praise about a young person or a parent or the dyad, the interaction, anything that we can find that's a positive aspect that we can praise. We also want to focus on what we want them to do. So we want to support them in really giving them information about what we want them to do. And we want to push them into some kind of action or giving them, but we want it to come from them, right? We want it to be patient-centered and patient-led. So we want to support them. We also need to guide, right? So it's providing a supportive comment. So in interaction with a young person, this could be something like, "I'm so glad you told me about marijuana use. I'm really glad we have a chance to talk about it now." So that's all you need to say, right? In that moment, like, "Thanks for telling me about that. It was really brave to share that with me. I really appreciate that you told me that," whatever it is. And sometimes, and I've had this happen, I'm sure you have had this happen too. A young person sits down in front of you and they tell you 29 awful things and one good thing. And you're like, "Oh gosh, okay, well, I guess I'm taking the one good thing and I'm gonna support and I'm gonna guide," right? So yeah, and that happens. People are dealing with a lot. And so finding those positive aspects, focusing on the things that are positive, and then guiding them, really helping them move toward a goal, helping them, fostering responsibility for them, and really helping them acknowledge their own autonomy. This is important for any patient of any age, but it's really important for young people. I think it sort of goes without saying that one of the things that young people are often doing in adolescence as a developmental stage is just pushing back generally on authority figures and on people telling them what to do. And if we approach it with the spirit of like, "No, you're right. This is your decision. This is your choice. I'm not going to tell you what to do or make a decision for you. I'll give you information and you can decide what's best for you." So when we think about guiding someone in a situation like, "Thanks for telling me about marijuana use. I'm really glad we can have a chance to talk about it. Tell me about kind of pros and cons that you've thought about when you've thought about maybe not smoking as much." Right. So just a way to kind of guide them towards moving toward a goal or moving towards helping them think through what they want out of a situation. So you all probably have your own ways of talking about all of this stuff, right? And so this is just one way, one example. As long as it's organic to you, it's good and it's great. Our team also created a video that kind of shows how to do this, so I'm going to show you that next. But just a script that's just something like, "Hey, it's great to see both of you. Today we're going to start by talking with everybody together, and then, young person, I'm going to, as with all young people your age, we'll have a little time to talk one-on-one, and then we'll invite your grown-up back into the room to wrap up. Young person, are you okay with that?" So whatever feels right to you in that moment, whatever that language, that feels organic to you, go for it. So I'm going to show you an example, both of a way to do it well and mostly a way to do it not well. And the way to do it not well is very exaggerated because this is a training video, but you all will get the point. All right, we're going to see if our technology works. It's going to work because we have a human being helping us. Hooray. Yeah.
In this next example, a provider is giving a quick overview of the appointment, but the parent is a little resistant to time alone. Again, this first example won't go so well.
It's great to see both of you. Today, the plan is for the three of us to talk together, and then, like I do for all teen checkups, Sam, you and I will talk by ourselves for a few minutes, then we'll do the physical exam, and then we'll wrap up with the three of us, and you'll be on your way. Sound okay, Sam?
Yep.
Any questions?
I don't need to step out. I'll just stay the whole time.
Well, I'm actually following best practice guidelines. Besides, teens can consent to confidential care anyway, so this is the way I do it.
I'm the one raising my kid. We will not be coming back here.
That's a tough situation, but it could have gone better. That parent probably won't leave the room, and they certainly won't be back. Let's see what a supporting and guiding approach could look like.
It's great to see both of you. Today, the plan is for the three of us to talk together, and then, like I do for all teen checkups, Sam, you and I will talk by ourselves for a few minutes, then we'll do the physical exam, and then we'll wrap up with the three of us, and you'll be on your way. Sound okay, Sam?
Yep.
Any questions?
I don't need to step out. I'll just stay the whole time.
Thank you. I really appreciate you saying something when you have questions or concerns. Can you say a little more?
I'm responsible for Sam. I'm raising Sam, so I want to know what's going on. And we have a good relationship. Sam tells me everything anyways.
I'm so glad you bring this up, and I love hearing that you two have such a great relationship. Can I share the 2 reasons we do this and see if it fits with your goals for raising Sam? And I actually have a handout on this too.
Sure.
We really just want teens to get practice taking responsibility for their healthcare and talking with a provider on their own, so they don't have to do that for the first time as an adult. We also want teens to know that their provider is another supportive adult when they have tough questions about their health. If there is a safety concern you need to know about, we'll make sure you know. As I mentioned, we'll come back together after this, and I encourage teens and parents to continue all of the health-related conversations we start here at home, building on the great relationship that you mentioned. So does this idea of slowly and safely increasing responsibility resonate with you?
Sure, that's fine.
Great. And are you comfortable with that, Sam?
Yeah?
Though resistance to time alone is uncommon, it does happen and can take a little longer to address. In this case, the clinician supported the parent by validating their role in the teen's life, and then guided the parent by sharing information and asking if it aligns with their values. Maybe the extra time this took means that time alone will be extremely brief, but the payoff is that this family will likely be back, and time alone will be more expected next time.
Okay. We had a lot of fun making these videos. I mean, I didn't make them. We worked with a company that did, but just the reactions of like, what should the young person say? And we're like, less, just like, all right. So, let's see, perfect. All right. So this is the QR code to grab those talk tools. So if you want to take a minute and do that, and you also, if you're like, nah, I don't need to, it's all good. It's all fine with me. chydeumn.edu at the bottom is also how you can navigate there if the QR code is not working for you. But what I'm going to share with you now is just a little bit more about these tools and kind of how we develop them and how you can use them or components of them or just really any aspects of them in your own work with young people. So the one that is up on the screen right now is, of course, helping your teen navigate healthcare. This is one that is a little bit actually different than some of the other ones in the format that it takes, because this one's for parents, right? So all of the talk tools that we created, the vast majority of them are for both parents and teens. Like you could give it to a young person or you could give it to their parent and it would be relevant for both. There's a couple though that we were like, yeah, this sort of needs its own lane. And this was one of them. So we actually created this one to give to parents. To help them kind of navigate all of this. And so this gives some kind of fast facts about like why the AAP recommends this. We have some information there around why it's really important for parents to keep the conversation going, to keep having those dialogues with young people, and really just to impress upon parents and caregivers that their young people really do care what they think and they really do want them to have these conversations, and that they that those conversations look different than the conversations we have as providers or educators or whatever, because that's not our role, right? Parents have a really unique and important role to play, and we need them to do it. So, and then we also always have resources at the bottom. Now, resources to me are like, resources are the minute they're printed often are outdated or old or a link breaks or something. So like use that as you want to, and you all have resources of your own. And there's nothing magical about these resources. Use your own resources as you will. But all of these tools really kind of follow, the rest of them all kind of follow the same format. And so I actually wanted to I put a different one in here. These were the changes I was making last night in my hotel at 9:45. I was working on this and people were like, what are you doing? And I was like, well, I realized this didn't make sense. So that's why I changed it. So be glad that I was a little ADHD yesterday in my room and working on this. This particular fact sheet is around healthy decisions about sex. And so all of the fact sheets kind of follow a similar format where we just have some general information about the topic. And so in this topic, it's about how does a person decide they're ready for sex? How does a person know that this is a healthy situation? And so you can see that there are some just quick facts up on the top for young people to kind of consider and think about. There are some Teens Let's Talk. So Teens Let's Talk is really open-ended questions. You can see all 4 of those are open-ended questions that you could ask to a young person if they said they had some kind of concern in this vein or some kind of question that they wanted to talk about or some kind of issue that was coming up for them. So a lot of our providers told us, okay, I need something that I can really quickly look at and like get some kind of an open-ended question to like guide my conversation forward. So that's really what these are intended to do, the open-ended questions in the Let's Talk portion for teens. Now we also want parents to keep talking. And so in the parents keep talking section, this includes prompts for parents to keep talking with their kids. And so these are also really helpful. Sometimes we don't have time to maybe go over it with the young person, but we might say, and I'm going to give away my hand a little bit here and go forward. These are all the topics we have, right? So if we say, oh, I'm so sorry I didn't have a chance to get to healthy sleep or vaping and marijuana and alcohol today, but I'm going to send this home with you so that you all can continue having this conversation. And then maybe when we see you in, whatever time, we can revisit this. So prompts for parents to keep the conversation going. So in this example, these are like, you're helping your teens really getting the facts, building trust, sharing your values, your expectations. So, and then resources, of course. So the topics are here. These are all the different tools. So that link or the QR code that you followed earlier takes you to a page that has all of these. There's a lot, and we keep adding them as people tell us that they need them. We've all of these weren't all originally here. We've added healthy sleep. We added screen time, social media. We added healthy eating. And then like you might notice it says prescription hormones. So yeah, there's one that says, that's funny. Okay. I don't have the one up here that says contraception or birth control. So we actually had providers telling us that they wanted a fact sheet. So some providers in rural areas actually told us that they wanted one that was called prescription hormones rather than birth control because that was a more sort of palatable thing in their community. I think that that's really interesting given sort of what I think comes up for most folks when you think about prescription hormones, which is not necessarily contraception, but for some communities, that was the way that they are being encouraged to talk about this. So we were like, okay, we will make you a fact sheet that is called prescription hormones. The rest of us, it's birth control fact sheet. But again, there are all these different topics that you can use in your work in whatever way makes sense. We're going to watch another video that is about, it's going to be showing you support and guide. And this one is around a situation around vaping, I believe. So we'll watch this one and look around for, again, watching for those supportive comments and those guiding kind of comments as well.
In this scenario, a teen just disclosed that they are regularly vaping. This first example won't go very well. Let's watch.
I mean, all my friends do it too.
I'm disappointed to hear that. You know it's not healthy. You need to make better choices.
The clinician's response in this example might be exaggerated, but we all have interacted in ways that are directive or confrontational, especially when time is really limited. The teen in this first example likely felt confronted and taught, and is unlikely to make a change. Let's watch again and see what it would look like to support and guide.
I mean, all my friends do it too.
I'm so glad we're talking about this and that you are willing to bring it up. What are your goals for your health? And let's think about how vaping fits within those goals.
This supportive and guiding approach reinforces the teen's disclosure and opens a guiding conversation that may lead to a discussion about finding trusted information, or may lead to a conversation about making choices that better align with the teen's goals for their health.
Okay. Yeah, I know the clinician in that one is like,
We're so
"What?"
glad that you're.
Oh, wow. It was like a playlist. Well, you all can just see the playlist. We also have a video about the age of consent. Come and check out all our resources, would you? All right. Perfect. So we'll go back to the slides and click through that. Perfect. All right. So what you just saw, of course, was motivational interviewing, right? So when you saw that clinician change their focus and kind of move into this different way of being with this young person, what that was motivational interviewing. So I'm going to talk to you a little bit about motivational interviewing. It's not the kind of thing that I expected. I mean, this is the kind of thing you can go get a PhD in motivational interviewing. I'm going to talk about it in like 8 slides. So it's not going to be, it's going to be a broad brushstroke. But what I do think is really important to think about is that I think there are components and pieces of motivational interviewing that all of us can use. Different components of it make sense so many places and spaces in our personal lives and our professional ones. So I always am like, take what you like, leave the rest behind. There's usually something here though that somebody's like, oh yeah, actually I could use that. Even if it's not in my my professional life, like it's something that I might use in a personal interaction. So motivational interviewing is really, it's collaborative, it's goal oriented. This is the official definition, right? Method of communication with particular attention to the language of change. It's designed to strengthen an individual's motivation for and movement toward a specific goal by eliciting and exploring the person's own arguments for change, right? So it's patient driven, it's patient led, it's about them, and it's about what their desires to change are all about. So I think what's important for people like you all that are working with youth to know is like, what is the spirit of this anyway? Like if you don't have to know all the words to say, you don't have to know all the perfect ways of doing it, but like, what is the spirit that you need to approach it with? I think if you do this, you're winning, right? You're doing a good job. So we want to approach this with a spirit of collaboration, right? Versus confrontation. So collaboration is a partnership between our providers and our patients, and it's grounded in the point of view and the experiences of the patient. And sometimes this can contrast with kind of the typical, like, clinician, client sort of expert role that the sometimes provider can take on. And collaboration really builds rapport and facilitates trust in helping those relationships heal, which is something that we heard about yesterday when we talked about trauma-informed strategies. So we know that collaboration is important, and we also know that like confrontation or confronting people, we just know that doesn't work. It's maybe our gut reaction. Of course, our gut reaction sometimes is to be like, "Are you serious? What?" And to really, push back on something that someone is saying. And if our goals are to get someone to see their own motivations for changing and to move along the sphere of change, even if it's a little bit, then we need to collaborate with them rather than confront them. We also want to draw things out and we want to evoke and we want to hear from them rather than imposing like what our own ideas are or what our own strategies are for like the way that they could sort of best be most successful. Really, your job as a clinician is really to draw out what their own motivations and skills are for changing. Especially with young people, often the reason that we think that they might want to change something is really different than the reason that's like intrinsic to them. We might be like, oh, you want to make this change because X, Y, or Z. And really internally, they're like, no, that's actually not it at all. And so let's not assume what our young people need or any people need. Let's ask them, right? Let's ask them, what is important to you? Why do you want to make this change? What is something that you think that you could do about this? Autonomy is, of course, paramount. It's paramount when we talk to young people, because often autonomy is the thing that young people are seeking the most in adolescence, and it's the thing that they feel like they're being sort of hamstrung on. They're feeling that they want independence, they want those opportunities to, explore and do things on their own, and they're often being told by adults and authority figures, no, you can't do that. And so really helping young people understand, like, yep, you are the expert in this. This is your health. This is your appointment. This is your life. I'm here to give you some information and you can do with it what you like. And then compassion. And I think that's the one. I mean, I don't need to spend any time on compassion. People in this field we've got compassion oozing out of us. That's why we do what we do. And it's integral, right? It has to be part of this spirit, and the spirit of all of these has to be present in order for this to really work and to feel collaborative between a patient and a provider. So there are a few principles of this that I know that you all probably use a lot in your work already. So this is expressing empathy through just reflective listening. And I know that reflective listening, you're like, hi, I have 10 minutes to get through this appointment. I don't have time for reflective listening. I get that, I really do. And I think that you can see in some of these interactions, even in the training videos that I was showing you, just those simple, small ways of shifting our language and the way that we are interacting with our patients. It doesn't actually have to take more time. And in fact, if it's done well and set up well, I think at the beginning of the visit, it can actually provide, you can actually get through more things if it's done in a way that's really listening to where your clients are coming from the very beginning. We want to help them really develop discrepancy. And I love helping people think about this. So it's not about helping people change or be like, this thing you're doing is bad and you need to stop doing that. It's really, for a lot of us, helping our patients and our clients develop a discrepancy between a behavior that they're doing and an outcome that they don't want. Right? Like, you're doing this thing that I know is going to maybe lead to a bad outcome, and you're also telling me that you would like to avoid that bad outcome, right? And then I'm thinking, here we are at the STI summit. It's like the STI example is the one that comes into my head most frequently here, and just in terms of like around condom use, right? So we see a young person in our care, and they tell us like, "Yep, I have chlamydia. I've got chlamydia again, and I've had it like 3 times, and I keep getting it." And right, and so we're in that moment of helping them say, okay. And then we're like, and tell me about your condom use. And then they tell us that they're not using condoms. Okay. Those are 2 things that we want to lay out for them to say, these 2 things are in conflict with each other. And I just want you to develop a discrepancy here. You're going to put that out there for them. They're going to come to that conclusion on their own. These 2 things are in conflict with each other. And how are we going to resolve them together? Right. If you just lay it out there and you say, these 2 things actually can't exist together in the same way, young people themselves will figure out, yeah, okay, I see what you're saying here, and I need to figure out a way to make a change happen so that I don't have that thing happening to me again, or that feeling that I want to avoid. We want to, of course, avoid arguments and direct confrontation. We want to adjust to resistance rather than opposing it directly. This is also known as like rolling with resistance. I'm sure many of you have heard of this concept. And of course, supporting their self-efficacy and their optimism. Young people are so amazing in terms of, all of the skills and the sort of just joy and optimism that they bring to situations, just because they're so fresh and so new in the world. So again, supporting those, and their this is also a time where their self-efficacy for many of them is waning. And so really finding ways to boost their self-esteem by telling them, giving them all the supports that maybe they don't get from other people in their lives. So being that supportive adult presence. So you can use motivational interviewing in just small little ways sprinkled throughout the work that you're doing to promote change by collaborating with your youth, with your young patients. So you can guide your patients, of course, to find their own motivations to change, which is what I talked about earlier. You can help them to resolve ambivalence. I think most of you know, with working with young people, a lot of what we experience isn't true resistance or like, I definitely don't want to do that thing. Sometimes it is. But a lot of what we see is ambivalence. A lot of the whole, like the Sam character who's just like, I guess, whatever, I don't care. That's actually, I think, a lot more of some of the resistance or some of the sort of sticky situations we find ourselves in is actually because young people are just sort of in this place of like, if it happens, it happens. I don't really care. And we want to move them, of course, to a place of like, what would it mean for you if that did happen? And how can I get you to care about this, right? And helping them resolve that ambivalence by moving them to a place of helping them think through, what a consequence, not a consequence, I don't like that word, but like what might be an outcome of an action that they might take, and how could we help them set a goal and help them set their own goals to change and support them in doing that. I'm doing a time check. Beautiful. All right, so this is patient focused. It's patient led. You all know this. We're asking open ended questions. We are non judgmental and we're expressing empathy and we're defining motivation and confidence and commitment for change. So these are some skills that you can use. And I think, again, like if you take another thing away from this, like these are really practical skills that you can use. We're going to go through each of them just real quick here. So open-ended questions are, I mean, again, you all know how to ask an open-ended question. We all mess up. I do it all the time. I ask a closed-ended question and then I'm like, whoops, tell me more about that. You know, and the next thing you do is just you say, okay, great. Thanks for, no, tell me more about why, something like that. But if you know that this is a thing that you can work on, consider thinking about how to change and strategize and think about how to make your questions more open-ended. Really, this stuff just elicits more from your young person around what they think and feel about something. And we're just more likely to hit the nail on the head around why they're there, what we can help them with, and how we can help them change when we actually hear right from the get-go what their thoughts and feelings are about something. So, we can change closed-ended questions to open-ended questions pretty easily by asking more what questions and how questions. I would avoid why questions. Why questions tend to be judgy. We don't mean them to be, and sometimes a why question is warranted. I'm not saying never ask a why question, but I think if you can go more towards the what or the how, those tend to be more exploratory and less sort of evaluation. How old were you when you first had sex? You could easily change that to tell me about your first sexual experience or your first experience with sex. Do you use marijuana? You could change that to what does marijuana use look like for you? Do you talk with your partner about STIs? How do you talk with your partner about protecting yourself? Right. So lots of little ways, lots of little nuances that we could make in our language just to open things up and get our young person talking. So affirmations are so important. These are different than compliments, right? So compliments are like, I like your shirt, and compliments are awesome, and everybody loves a compliment. And an affirmation is something a little deeper. It's something that's more focused on really the attributes of that person and sort of what they bring to the scenario. So you can do things that are very short and sweet, like you followed through with the plan you made for yourself. You can also really go deeper and look at things that are really like positive characteristics that support change. And you can really, really highlight those things. So if there's somebody who, I mean, even if again, like that, going back to that example of the 29 bad things and one good one, if there's one, what is it in that one good thing? Do they have some persistence or commitment? Are they organized? Are they loyal? Are they a good friend? Are they, helpful, right? There's always something, right? There's always something that we can find in a young person's sort of behavior and things about them as people that support change. And so these are just some like sentence starters or ways that you could compliment or praise a young person. And again, affirm them and move beyond just a compliment. The quote that I really like that some of my colleagues share sometimes is highlight the effort, not the outcome. And I like that a lot. All right. Reflections. Reflections are statements, not questions. Your voice should go down at the end so it does not sound like a question. I am so bad at this, y'all. I work on this constantly and I am still very bad at it. Oh, I'm sorry. The formatting got a little wonky in here, but the point still stands that when we reflect, it's really helpful to just say things like, so you're feeling. So what I hear you saying is, let me hear if I'm understanding you correctly, something like that, right? So it sounds to you like, and it's just a way to reflect back. Again, you can reflect back resistance. You can reflect back, like I'm hearing you say that you are not, you're not like, resistant to this today. You can reflect back ambivalence, which can be interesting. I was talking about that earlier with this paradigm of like putting these two things out there that are kind of in conflict. You can also reflect change talk. Right. So, and I haven't talked about change talk yet, but change talk are those moments that you love as a clinician or a provider where someone says, yeah, I'm thinking about maybe doing something differently. Or like, yeah, the last time that this happened, that really sucked. And I don't want to have that happen again. Like, okay, yes. Those are the moments where you're like, cool. Okay. The gears are turning, like we're getting some movement. We're getting some things to happen. So those are the moments where you reflect back. So what I'm hearing you say is this, and it's really important to do it because as I said earlier, often we mess it up and we don't get it right. And we say back to the young person, and they're like, well, actually it's this. And then you're like, cool, I understand. The other really important thing to do is summarize. Summarizing is really hard to remember to do in the moment, but it's really, I think, helpful for time management to move us on to what we're doing. So really important to just kind of summarize what was said and move on to the next thing. And I'll do that now by going to the next slide, modeling for you. All right. So also attending to the language of change. Again, these are these moments where when young people say these things to us, we're like, yep, great. This is the moments where young people are thinking, I might be thinking about doing something differently, but I don't know how, or I need your help, or I don't have the confidence, the skills, the resources, whatever it is, but that's your job then to figure out what's going to happen next. So the language of change talk can be what's being said against. So this can be sustained talk. This can be like, here are all the reasons why I can't do it. We've heard those things from young people too. We hear those kind of things in conversations with our teen patients. We want to encourage this movement away from sustained talk, which is all the reasons why it can't happen or why it's too hard or why I can't do that, and move them towards, again, like change talk or these positive attributes that kind of support a change. And then the last one's exchange of information. And this is just the idea you saw in the video. I think there was a moment where they said something like, would it be okay if I shared with you some information? And that's all that is really just respect that there's expertise on both sides of this, and it's asking for permission to provide information, and it's a two-way street. All right. So using talk tools in practice, we're going to watch another video. I'm sorry, I know I caught you off guard. This one is about like sexual orientation and dating, I think. Not I think, I know, that's what it's about.
In this short example, a teen discloses they are interested in dating all genders. Let's watch.
So, you're starting to date. Do you know yet what genders you're interested in? Guys? Girls?
Both, actually.
Great. And how's school going?
It can be hard to know what to say in some situations. Let's see how the clinician uses the talk tool to support and guide.
So, you're starting to date. Do you know yet what genders you're interested in? Guys? Girls?
Both, actually.
Thanks for sharing. I'm glad you felt comfortable enough. Sometimes this is something that teens find helpful to talk about for a minute. Is that okay with you?
I guess. I mean, I haven't told many people.
Well, I'm honored that you told me. This is something that all teens think about to some extent. Have you seen this gender unicorn before?
Yeah. I saw it online.
I'm curious, what support do you have as you think about these things?
This clinician could use the talk tool to go on and help the teen identify what support or resources they need, including looping in the parent if the teen feels able to do that.
All right. I know it was like, okay, we couldn't make all these cool videos and not show them to you. So, and we made one more. And this one actually we worked with. So how many people are familiar with Amaze? Amaze.org? No. Okay, great. Oh, I'm telling people that don't know about an amazing resource about an amazing resource. This is fantastic. Okay. So there is a really, really great set of videos. It's from amaze.org. And I should have not assumed that folks here knew what that was. In education land, we use these videos all the time. They are made by Advocates for Youth. So all of these are on YouTube. And they have a video about darn near every topic that you could imagine related to sexual and reproductive health, and actually kind of just any topic related to identity development, young people. So they're funny, they're animated, they're cute. Ours is probably like the least cute and the least funny of all of them. Like they're so great. I would definitely encourage you to share them with your patients, clients, the young people in your own lives. I used to have a friend who would make her kids watch one Amaze video before they could play video games. She was like, you need to watch the one on consent and how to talk to your partner before you can watch video games, play video games. So what I'm going to show you next is, so this is a video that we created in partnership with them. And this was around how to prepare your teen for a doctor's visit. So again, not exactly the perfect, the audience, but I do think that there's components of what's here that'll be helpful for you to share maybe in your setting. So we'll give it a watch.
All parents want their teens to grow into responsible and savvy consumers of healthcare. And we all know that teens need support in developing and practicing responsibility as they age. Here are 3 things parents can do to help teens gain important healthcare experience. 1. Prepare for an annual checkup together. For example, a parent can ensure that a teen has time and privacy to complete pre-visit questionnaires on their own by saying, "These forms are for you. I'll give you space, but let me know if you have any questions." A parent might also help their teen prepare for an upcoming visit by brainstorming questions to ask and prompting the teen to write them down. Or a parent might encourage a teen to go through the process of scheduling their next visit online or over the phone. 2. One-on-one time with their healthcare provider. Give teens an opportunity to have conversations with their healthcare provider by themselves. When teens have time alone with a primary care provider, it offers them 2 important opportunities. First, it gives the adolescent experience in taking responsibility and managing a healthcare interaction on their own. Second, it gives them a chance to ask any questions that may be embarrassing or difficult to discuss in front of a parent or guardian, which many of us likely experienced as adolescents. It is recommended that teens start to have one-on-one time with their healthcare provider around age 11 or 12. 3. Keep talking. Keep talking about health and healthcare topics at home. In spite of how it may feel sometimes, parents truly are adolescents' main source of information and support. 2 great resources you may find useful are amaze.org, which provides fun animated explainer videos for young people and a range of resources for parents. There's also the Talk Toolkit for Adolescent Care from the University of Minnesota. You can go to the website linked below for helpful conversation starters and guides for parents to use. By involving teens in their healthcare, parents help them build confidence and take charge of their well-being. Empower your teen to become a proactive partner in their own health.
Yeah, those videos are so they're all kind of like that in that vein where they're fun, they're animated, they're cute, like the stuff about the kid not doing the dishes. Like they're just kind of sweet and funny. And I love that I forgot that there was a call out right before the talk tools to the actual amaze.org website and page. So I'm glad we have that listed in there as a resource for all of you because again, there's just great stuff on there for you to kind of probably peruse for all kinds of different things that you could use it in your lives. So as we wrap up our time, and I'll leave some time for questions. Really, what I wanted to leave you with here is really kind of what language stands out for you here. I really want you all to think about, what works for you here and what doesn't. And it's okay to say, yeah, that wouldn't work in my community, or that kind of question doesn't really resonate, or that's not how I would ask it. That is totally okay. What I'm here to do today, again, was share resources and all kinds of information with you so that you could take what makes sense for you and leave whatever, doesn't make sense behind. And, things around confidentiality and other things like that might look different in different communities, or there's just different considerations that are going to happen in different places. And so take what works, kind of leave the rest behind. As we think about kind of what I want you to kind of walk away with, what I want you to walk away with is that you have a tremendous role to play here in helping young people be sexually healthy. When I think about that triad, I mean, there's a reason why we do these things and why we, impress upon all of you how to do this well and how to keep coming back to it and keep getting better at it, because it is so, so important. Adolescents really want to have these conversations with you. They really do. And their parents really want them to have these conversations with you. And there are so many ways that you can do this, places that you can sort of exert your expertise and your compassion. Young people often don't have a supportive adult to talk to about these kind of things. And so if you can be that person for them, even a little bit in this clinical space, that is a beautiful thing that a lot of young people do not have. There's adolescent care is obviously, you all know this, there's a really, kind of tricky dance, right, of direct care, which sometimes is confidential, and parent engagement. We didn't even talk about confidentiality laws and all of the different things that you need to dance around with that. There are a lot of things that make working with adolescents more challenging, but also I think more rewarding too in that vein. And just know that there are tons of resources to support you. We use the Shades, of course, paradigm for, for a psychosocial interview. And then of course these talk tools for brief discussions and counseling. There's lots and lots of resources to support you. We are not the only toolkit by any means. There's lots of other great resources out there. But I did want to just again, thank you all for having me here. These are the references that I shared today. Most of what's here are the academic references from the research papers that I shared and referenced. If there's anything that anybody needs from this slide or wants from me, I'm very happy to share. Like if, I'm at the university, so if you want to read any of these papers, I'm very happy to send you the whole thing if you can't access it in whatever setting you're in. And thank you. Thank you for all the work that you do to support young people and to be that supportive and non-judgmental and open presence when they walk into a clinical space. That is something that not very many young people, I think, get the privilege of having. And so I just really appreciate the work that all of you do. You make a difference and you really matter in a world that's really hard for young people. You're a shining light. So thanks for having me, and I will be very happy to take whatever questions folks have. All right.
Thank you.
You're welcome.
Thank you very much, Jill. We have quite a few questions in the chat from
delightful.
online audience. From earlier on in your presentation, here's a question. How were you able to successfully recruit youth and their parents to participate in your study? Over 1,000 pairs is a lot.
Yeah, it is. So, I work at a research university, right? And so we worked with, we have lots of strategies that you can use to work with. We worked with a research institution to, get the word out and to recruit for the research study. Now, in terms of the interviews that we did, we actually did rely on folks that we knew and people kind of in our networks to say, this is a provider you should interview. This provider would really like to speak with you. And we used a lot of the existing connections that we have in the sort of adolescent medicine and adolescent world in the kind of upper Midwest to do that. And then we paid them. You have to pay them. So we paid them. Paid them for their participation in the study, and it was a small gift card for participating in the sort of questionnaire, and then the actual dyads and the longer interviews were also people were compensated.
Nice.
Yeah.
Okay. Hey, do you think that the techniques that you're talking about would be transferable when dealing with a teen who's presenting to a sexual assault nurse examiner or a forensic nurse?
Great question. The techniques that I shared with you are so broad and so applicable that I do actually think that they can apply to lots of different scenarios and situations. Again, these are about people and how people make decisions about their behaviors and about what choices they make in their lives. And people who are in the scenario that was described in that comment, also I think would be in a situation to deserve, to be received with the same kind of motivational interviewing skills, of course, albeit slightly altered, to receive the person in that moment. There's been a lot of research that's looked at, does motivational interviewing work in other cultures and in other places? And obviously there are of course, alterations and people need to make changes based on where they are. But that's why it's actually a method that people like, because it can be used in so many different settings, because it's all about the skill of the person that's doing the intervention or using the skill. So if you're in that community and you're part of that world and that's the skill you bring to it, then there doesn't need to be an argument about what, is this the right person to be the messenger because you have that skill set. So hopefully that makes sense. Hopefully I answered that in the right way.
Thank you.
Yeah.
Here's another one. You know that our audience is a lot of local and tribal health department staff.
Beautiful.
And the question is, how can the local and tribal health department staff support providers, private providers, I think they're talking about in our community, support providers regarding talking to teens about sexual health? So we need to communicate with other types of agencies and get a message across. What do you think?
Yeah, I think that is really that's the job, right, of local and state public health departments, is to try to get the word out, and all public health departments is to try to figure out how to communicate to the public these public health messages that we know are important. I think that this is where, again, you look at all the resources that are available to you and you figure out what kind of things make sense for Wisconsin, for our community, for our county. I think the more local you can make things, the better received perceived it is, and especially among young people, right? A lot of times what happens is when we present information or resources to young people and they aren't local or very specific to them, it's very easy for young people to dismiss it, right? And be like, that's not about me. That's not about my situation. That's about those kids over there. And so I think making things as local as we can for our sort of, our folks working in local public health. And then, amplifying the resources that we do have with the limited resources that we have. Because that's the other thing. It's like, I could give you a bunch of strategies, but like with what money? So I think it's like leveraging what we are already doing, and this is why I was like, I have all these free resources, please use them and use them in whatever way you want to, right? They were developed for the field and we want people to use them. And so if there's something in it that doesn't make sense, don't use it. Take it and use what makes sense for you.
Thank you.
Yeah.
How does talking about sexual health change among youth who may not have any support work? Youth that are maybe in foster care or living with people who aren't their parents.
Yeah.
How's that working?
Oh gosh. Well, I mean, it's even more important, right? For us to be another sort of supportive adult presence for young people who maybe don't have those kind of supports at home. And so that is, or wherever they're living, that is one of the things that we can do in our clinical conversations with young people to help them figure out who is an adult you can talk to. And if it's not you, somebody else in your setting that can help that young person figure that out. That's kind of the number one thing that we talk about with folks that are working with youth in juvenile justice settings and in foster care settings, and in settings where, or out of home placements where maybe they just cannot talk to the people in their households. I work a lot with the folks that do foster care placement in Minnesota, and we have a lot of conversation about how challenging it is for young people to navigate like placements and not knowing if the family that they're going to be with is supportive or can help with this or is going to be okay with this conversation. And so I think I think it's even more important for our young people that don't have this support and structure at home that we help them figure out who can be a support and where they can get that. And there are actually places, even if they're like, I don't have anybody, there are chat lines and text chains and like there are things that we can hook young people in with, and we can always be a supportive presence for our young people too.
Do we have any in-person questions in our audience today? I wanted to check, but there are a couple more in here. Let's see. You mentioned that teens want an opt-out, not an opt-in for a one-on-one conversation with their provider. Can you offer some more examples of opt-out messaging that you'd use with the teen and parent?
Yeah. So, I mean, really there's a couple ways to think about this, because one can be like, it's a paperwork thing, right? So it's just the way that it's done in the clinic setting. But I think there's lots of examples, and you saw a couple in the slides or in the training videos in terms of just like the language that's used to talk about it. But I think, in terms of like, helping up a young person and helping their parents like understand that this is just sort of a standard thing that I'm doing at this age. It's not because I have any particular worry or concern. It's just to give your young person a little bit of time to talk with me. And I think, again, going back to like health literacy and helping young people be good consumers of healthcare, that's something that I think a lot of parents are like, oh, I hadn't thought about that. That's actually an angle that I think we should probably consider working a little bit more. Like, we want your young person to be prepared so that when they're an adult, that they can go into a clinic and a conversation with an adult or with a provider and be able to say what they need and get what they need from a clinical conversation. And that often is a different way of thinking about it for an adult that hasn't maybe considered that perspective before. All right.
Anybody here have a question?
I've enthralled
Who has a
them in
question?
person.
That's what I'm really asking.
Is anyone awake in the room? No, just kidding. You're all awake. I see you. Yeah.
Ashley.
Hello. I was looking to find out some more like tips to rolling with that resistance. I know
Yeah.
a lot of adolescents it's what you had in the video. Yeah. Those like one word answers, and you don't want to turn into that, I'm the expert, I'm going to talk to you and tell you about it. But at the same time, if they're not really giving into your guiding,
Yep.
do you have any tips on how you can handle those situations?
Yeah, totally. Oh my gosh. Yeah. Rolling with resistance is easier for some of us than it is for others. So there's a couple things that you can do. One is so really just to acknowledge that like, yeah, this sounds like something that like you have a lot of really strong feelings about, or it seems like maybe we disagree about this, or like you have a different, you're looking at this differently than I am. So sometimes with resistance, it can be helpful to just seriously simply say like, I don't know if we're gonna agree on it. Can we move on to talk about this other thing? And then if we still have time, we can come back and talk about that. Often I will just table something that somebody has just given me a lot of like back and forth about. That can be a way to kind of move past it. One of the things that the literature about motivational interviewing talks about with rolling with resistance in terms of sort of what not to do is so you can sort of play the devil's advocate, but this can backfire on you, right? So this is where you have to be very careful and you have to know your young person. And I would say it's the kind of situation where most of us don't know the young person that we're seeing in a clinical setting well enough to be able to like make this work. So here's an example of what I mean. If a young person's like, I'm not using condoms. I told you I'm not using them. I don't like them. They do not work for me. And so an example of this where a provider could like, it's sort of like amplifying it back to them and saying like, so there's never a situation in which you would use it. Never, right? You can see a scenario in which a young person in the right scenario might kind of go there with you and might be like, and kind of just like, get into it with you. You could also see how that could absolutely backfire and have a young person say, like just cross their arms and just be like, no, aren't you listening to me? I told you what I mean. So I think that you have to figure out in that moment for your young person, like where they're at with resistance. And if you know them well, you can push back on it. But I think oftentimes hearing why they're resistant and saying like, yeah, that makes sense. Or I understand why you feel that way. Oftentimes they have never had any compassion around the reason why they're resistant. And so even just offering that moment of like, that makes sense, or I understand why you feel that way. The other thing sometimes around resistance that can be helpful, again, is highlighting discrepancy. That's what I'll do a lot of times when young people are like, but I can't, but I don't wanna. I'll just be like, okay, so I'll lay that out here. That's the thing you're telling me. And then you're also telling me this other thing, which is that it doesn't feel good to get diagnosed with an STI, or it doesn't feel good to get cheated on from your partner, or it doesn't feel good, whatever the thing is. Like you're laying those two things out there and you're letting them come to their own conclusion about like, yeah, I see what you're saying here. And you don't have to hit them over the head with it. Young people are smart enough to figure that out. So I like to use that one also when I'm talking with young people to help them see like, these two things are in conflict and you're smart enough to figure this out. Go. So does that help? Cool. Of course.
And one last question.
Yeah.
What advice do you have for staff who work in agencies that maybe are not public health agencies, but are community agencies or STI clinics, et cetera, and they want to increase communication and talk with their youth about sexual health and STIs, and they're also mandated reporters, and maybe they hear something that they're not sure what to do. What would you suggest?
I love the most complicated question coming with 1 minute left. No, I'm just kidding. That's how it always goes, right? Okay, there's so many components to that. I'm sorry, Lori, can you read it for me again? I'm gonna write down the components as you do it.
Yeah, I kind of paraphrased. Okay, because in Wisconsin, we do have statutes that talk about mandated reporters and have exceptions and things like that for public health. But for agencies who are, private or community agencies, nonprofits, whatnot, they may or may not have the same exceptions in the statutes for hearing things from youth and needing to mandate or not. So it is often a state by state thing. I do know that. And I will reach out to the person who put the question in to try to give some more specific detail for Wisconsin. But yeah, so when you hear something that you go, oh gosh, what do I do?
Yes.
Who do I tell someone this, or am I working with them? What can I do? Again, there are some exceptions to that mandated reporting rule in Wisconsin. but maybe, and I'm sure it works different in Minnesota.
Yeah, right. Exactly. It's different in every place. So the first thing I'm going to say is that like rely on your training partners at HCET. I know that they have resources in this vein,
And your
right?
state health
training, like,
department, STI staff who can help
Beautiful.
you too, reach
Yeah.
out to us. Okay, so
Yes, absolutely. So like know your
Love
agency policies and all those things. But the three components that I shared with you that are around like agency policies and clinic policies around just how to make a clinic more friendly for young people, using these kind of tools in, just in these interactions, and then just using a supporting and guiding framework. I think no matter what kind of a clinic setting you're in, you can adopt sort of little components of that, little pieces of that. The research study that we did, where I was saying like, here were our goals. Our goals were to like increase time alone among providers and do all these things. We actually did those in clinics in rural Minnesota that were not teen clinics, right? They weren't clinics that saw that like that's their primary focus. Really, they were a lot of what you're describing actually in terms of the agencies that you described were the agencies that we did this program with. And one of the things that I think is most successful is doing it clinic-wide, having some sort of clinic-wide, like we're all here together to like everybody has a role to play, right? The front desk person has a role to play, and so does the clinician and everybody in between. And I know that these are things that doesn't come as brand new information to folks, but I do think that for people that don't have a ton of like direct or like a lot of interaction with young people, it can feel like the learning curve is big. And so like lean on all of the stuff that's already been created for you, and whatever you can do to move it forward is better than what you were just doing a little bit ago. And so that's great.
Okay, well, soften it up with one last question or a comment from me. Tell me your favorite technique which you like to use. Just give me a quickie from what you shared with us today.
Oh, I will give you my favorite one. My favorite thing that I have learned through motivational interviewing is to connect two sides of a sentence with and instead of but. Simple, very simple.
Fantastic.
And it absolutely kind of lowers the temperature because it's less confrontational. And I do it all the time.
100%. It works.
Fantastic.
It does.
It does.
That is a fantastic one.
Yeah.
And now it's time for a break.
All right. Thanks, everybody. Thanks, everybody online.